we're going to now, focus on the vaccination drive. And to get you the latest data on that, 74.38 crore vaccine doses have been administered so far under the nationwide vaccination drive. According to the Union Ministry of Health and Family Welfare, there are 3 states and as well as 3 union territories where 100% eligible population of 18 years and above has been vaccinated with at least the first dose. All adults in Sikkim, Dadra and Nagar Haveli, Himachal Pradesh, Goa, Ladakh and Lakshadweep have got their first dose at least. Over 40.4% of population has received the first dose in India, and 12.7% of the population has been fully vaccinated. So over 12% fully vaccinated. Dr. Mehta, so very welcome that our vaccination drive is moving in the right direction, though it's still far away from getting 60% of the adult population fully vaccinated. What are your concerns currently?
So I think to put it in perspective, if you look at the last 9 months, we started slow. We had our hesitations. We probably did not move as fast. But come May onwards, I think we are doing very, very well. On the global scene, we are, I think, the highest vaccinators. There was lovely encouraging news recently that India has vaccinated more than the G7 countries. We're talking UK, US, Canada, Italy, Germany, and Japan. So we're doing very well. Numbers like 1 to 1.28 crores are amazing. So that's what the performance on the ground is. However, there's always a however is that we need to vaccinate much more. The number quoted is 10 million a day to try and hit the target of what we are planning to do by the year end. We need to ramp up more. We have the stocks. We have the motivation. The problem is our massive population in an attempt to hit a higher number. This Delta put a higher number on us. Otherwise, it used to be a good 60, 65. The Delta number has been elevated to around 80. But currently, I think what we're doing is good. We need to ramp up even further. We are on track, and we somehow need to also hope that the virus supports us and these variants don't come in overdrive again. If that doesn't happen, between the current efforts, the ramping up of what is there, the commitment and the aim, we should be able to achieve a reasonable endpoint.
Yeah, I'd just like to share a tweet that was retweeted by the health minister, and this is a BJP tweet in which, you spoke about the countries and how we've vaccinated more than some of the countries, and in fact they've shown that we've in Uttar Pradesh the doses given is more than the US. This is in September. Gujarat has given more than Mexico, and Karnataka more than Russia, Madhya Pradesh more than France, Haryana more than Canada. This is talking of percentages there. But Anand Bhan, we were talking about concerns around the vaccination drive. It is continuing rather steadily, and but even so, we still, it's a long way to cover 60. And now, as Dr. Mehta pointed out, 80% of the population, if we talk about the Delta variant. What are your concerns?
Yeah, so first of all, I'm happy that, we have picked up pace. I think there were concerns a few months ago that, we had very ambitious targets and perhaps not the wherewithal in terms of production capacity. I think we're doing very, very well, which is great. I think this momentum needs to continue. The concerns, of course, will be that we need to maximize our population coverage in the shortest possible time, while ensuring that we are keeping track of any adverse events following immunization, while ensuring that we are keeping trust in these efforts and addressing any misinformation or rumors. And the third important part is while also ensuring that routine immunization does not suffer. Because as we are so aggressively vaccinating for COVID-19, we have to remember that there is a whole cohort of kids, pregnant women, etc., who still need their regular immunization. And it's the same immunizers, essentially, the antenatal midwives, our nurses in our facilities who have to do both of these vaccination drives. So it's important for us to ensure that there is no drop in routine immunization.
And are you seeing, hesitancy like we did in the early days? Is that still a concern, vaccine hesitancy?
I think it's lesser so. I would say that it is probably a concern in some pockets. And quite honestly, this has to be something which is an ongoing conversation, because new rumors will keep coming up. People will raise questions around, is it okay to give this to kids when a vaccine for kids becomes available? Do we need a third dose? Is this vaccine effective against a new variant, etc.? So I think that is an ongoing conversation. I think probably it's less of an issue. Rural uptake has been fairly good across the country, but we need to keep a close watch to address any misinformation.
Right. Dr. Mehta, if we take a look at Kerala right now, where we're seeing most of the cases that are currently being reported in the country. India has reported to 27,000, over 27,000 cases. 20,000 have come from Kerala alone. But it's also the state that is reporting the maximum number of vaccinations so far. They vaccinated 67.3% with one dose, 26.5% with both doses. So that's, very interesting, the data coming out of Kerala.
So Kerala's data, I think, reflects an interesting part of the COVID paradigm, the way it jumps. It's like hopscotch it plays. So Kerala probably was the last stop of the hopscotch of COVID in India, where it landed, and we believe that Kerala's the second wave came much later. Also, it was shown also in the first time when it hit the US. The better job you do in trying to keep people away from COVID infection, the more you're likely to have the impact of the later waves. It's a very profound statement. So in such a situation, if you've done a great job, then down the line, if it spreads like crazy, and we're seeing that in New Zealand also, where ultimately there's only so much you can stop. The good part is, what we understand is the hospitalizations and deaths are minimal. Healthcare giving people back their lives despite infection is amazingly good at this point. Two, ultimately, at the same time, vaccination is ramping up, which means down the line it's going to be a very effective strategy. So we may also see that 6 months later, you find Kerala is again trailing everywhere. God forbid something else comes, because they saw the second wave later, they're vaccinating later, and their infections are later. So I think it's part of a staggered phenomena. The good news is that despite all the worries, it's not spread to other neighboring states. We have not stopped our vaccination drive, and because we have no option. Our vaccination is imperative. Our ticket out of what is this. And we are trying to lead the country literally, the globe literally, because we have such a colossal task on our hands.
Right. And finally, Anand Bhan, the third wave concerns, they still remain even as we're now going into the festive season. So that's a point of worry.
Yeah, of course, we need to keep a close watch. Listen, I mean, this whole conversation is important. Has the second wave ended? Has it really not ended? Because Kerala and Maharashtra continue to see cases. There are other parts of India where seroprevalence rates are relatively low, which means that there is still a fair bit of susceptibility to infection. But at the heart of it is just being watchful, ensuring high vaccination rates, keeping on testing where required to ensure that we know if there is a spread of infection, if we know there are new variants happening, and then hopefully ensuring that we don't see the rapid rise that we saw in the second wave anywhere in the country, because that is where a major challenge happens when health systems get overwhelmed, both in the public and private sector. If that happens, then it's very difficult to be able to prevent deaths, etc. So we need to ensure whichever way that we prevent that, and the more number of people who get vaccinated, probably less likelihood of any such waves happening.
All right. Well, thank you so much both for joining us on the program and, discussing these very important issues, especially the vaccination drive. Thank you for joining us.